Now, usually when we gather at the Centre for Dialogue, we pause to acknowledge the unceded traditional Coast Salish lands of the Squamish, Tsleil-Waututh, and Musqueam nations where our centre stands. However, as we gather remotely today, I feel it is important to also take a moment to ground ourselves on the various lands we may find ourselves on. Personally, I am connecting from my home in Surrey, BC, which spans unceded traditional territories of the Semiahmoo, the Katzie, Coquitlam, Kwantlen, Kikite, and Tsawwassen First Nations. So I invite you to take a moment now and reflect on the territory that you are on, and share where you're joining us from in the chat box if you feel comfortable. I also, and just a quick reminder to have your video and sound off for the beginning here. I also think it's important to recognize the ways in which experiences of discrimination based on disability, as well as the impact of COVID-19, are further compounded by systemic racism, including anti-Indigenous racism and anti-Black racism. We're gathering today at a time when these intersections of oppression are at the forefront of our discussions. And I invite us to keep this awareness in our minds as we enter into this important conversation on equity and human rights. A few housekeeping notes for today, which are listed on the slide in front of us. First of all, the session will be recorded, and we will be providing a transcript in the follow-up email, along with links to key resources mentioned in our conversation. If you experience technical difficulties, I invite you to connect with our technical host, Sabrina, through the chat or by email. Around 1:45 today, we will be taking a 10-minute health break to get some tea or go to the bathroom, whatever you need. And when we resume, our panel will be engaging in a Q&A session. If you have a question, we invite you to share it in the chat box at any point during the discussion, and our team will be collecting these for the Q&A. Alternately, when we begin the Q&A session, you can send us a note and we'll invite you to share your microphone and your video so that you can either speak or sign your question, however you're most comfortable. Our panel discussion today is hosted by the Morris J. Wask Center for Dialogue, whose mission it is to foster shared understanding and positive action through dialogue and public engagement. After a year of research and consultation, we recently launched a comprehensive guide, Beyond Inclusion, Equity and Public Engagement, of which our moderator for today, Jules Smith, was a peer reviewer. We were very grateful for that. We were wrapping up that project when COVID-19 reached BC, and we felt really compelled to leverage our roles at the center to host further conversations on equity specific to COVID-19, including a panel with Cicely Blaine and Alia Ali that we hosted in March, exploring how to foster safety and equity in online engagement at this time. And you can, we'll be sending some links to those webinars if you weren't unable to attend them earlier. And today we are joined by a really amazing panel of speakers to explore the particular challenges members of the disability community face during COVID-19 and how policy responses can better uphold equity for the disability community in this time. Moderating this discussion is feminist disability activist, scholar, writer, and artist Jules Smith, a strong voice for human rights in Canada. Oh, I'm going to change the slide to the one with the picture. A strong voice for human rights in Canada, Jules is a chairperson of the Council of Canadians with Disabilities and a PhD candidate at UBC Okanagan. Amongst our panelists, we have Heather Walkus, who has 45 years experience in community development and community mobilization, both in Canada and internationally. Her work is based through a human rights lens in the areas of accessible design, health, education, transportation, and cross-disability issues, with an emphasis on women, trauma, and human trafficking. She is currently the co-chair of the National Coalition of People Who Use Guide and Service Dogs in Canada, and represents them on the Canadian Transport Agency Accessibility Committee. She is also the chair of the BC Coalition of People Who Use Guide Dogs. Eileen Davidson is a rheumatoid arthritis patient and blogger from Vancouver, BC. She's a regular writer for Creaky Joints, an ambassador with the Arthritis Society, and patient advisory board member with Arthritis Research Canada. Healthline, Everyday Health, and Health Central has called her blog and social media channels one of the best in the arthritis community. When she's not advocating or writing about arthritis, she is focusing on exercise, painting, and her young son, Jacob. And last but not least, we are joined by Miles Stratholt, Senior Policy Analyst for the Targeted Learners Support Unit of the Provincial Ministry of Advanced Education, Skills and Training. Miles has been living with a mobility disability since the age of 11, and after working in fish and wildlife management, he moved into the area of post-secondary supports for students with disabilities in 2008. Miles has been active in disability advocacy for many years and presently sits as a provincial chair of the National Students with Disabilities Committee. And with that, I have the great pleasure to turn it over to my colleague Jules and to invite our panelists to join with our video and open up the discussion.
Great, thank you so much for that, welcome and all of the information. I'm just going to update a little. I am now past chair of the Council of Canadians with Disabilities. We had our AGM on the weekend and I did not run. And I'm excited though to also say that Heather is now our first vice chair of the Council of Canadians with Disabilities. So we've added a little to her workload. So welcome everybody. I was really excited to have an opportunity to moderate this panel. I'm very passionate about the issues of disability and human rights, and the responses that have been not happening for people with disabilities across the country have been very distressing to our community, and we are looking for ways to look at policy and make improvements, and to push back and notice things that maybe can change moving forward as well. So first of all, I just want to say many of you know that we're still waiting on any response in financial means, which has been a little bit upsetting to watch BLC 17 fail about a week ago. And we're hoping that government will be addressing something, but I've been reaching out to colleagues and I'm hoping with your questions today, how would be a better solution to that bill? As we know, less than 40% of Canadians with disabilities would have benefited from it, because most people with disabilities, myself included, are not registered with a disability tax credit. So that's one part of just to think about if you have ideas as the conversation around policy interventions goes on. I brought my 3 colleagues into this conversation because I believe, as you heard from their bios, that they each bring unique perspectives. Heather is an Indigenous woman and she brings a perspective of living in a rural community and being a blind Canadian and the very particularities of responding to COVID-19 in that. Eileen, as you heard, is a parent, and I think it's important to hear how parents are struggling through the pandemic and coping and figuring things out, and to make sure that policy responses will be addressing those issues. And Miles brings the perspective of working in government and really understanding the nuances of how policy is developed and written and what is possible, and understanding the ways of bridging the conversations that happen in our community and then approaching government about solutions. So I'm very grateful for that. I do bring a human rights perspective when I talk about disability. So I just want to note that in my approaches, I will always talk from that perspective rather than a charity model or from a medical model. So with that, I'm going to open up. And so we're going to do rounds of questions that some prepared ones and some other ones that the panelists are ready to discuss. So my first question is for Heather. So what are some of the day-to-day issues of COVID-19 and how COVID-19 responses impacts the cross-disability community?
Well, I think it's important to first say that it's not only the responsibility of the disability community to look at these gaps and to look at this exclusion. and also that the policies that the government used pre-COVID and are well entrenched in society and how we're viewed is not that there's cracks in it. It's that it's designed that way. It's designed for exclusion. Otherwise, we would be included. So it's pretty simple. So as COVID hit all of us, consider the issues that you yourselves had to deal with, then add on issues of, say in the blind community and low vision community, just leaving your house and other people approaching you and getting too close to you. There were no PPE supports to anyone, let alone the people in the disability community. So masks and other things that could have assisted us. So as we walked down the street, people were getting too close to us. We were unable to move out of their way, maybe because of distancing for low vision. Someone in a wheelchair couldn't just go off onto the road, which a number of people were doing, walking onto the road. And people seem to have the sense that if you already have a disability, that we were somehow protected by COVID, because they would lean over and talk to us right into our faces if you were in a wheelchair, or get much too close to us when we had a guide dog. When we walked into stores or attempted to get into stores, everything became, for the blind and low vision community, all visual, where you could stand, those little stand things that are on the ground, the arrows, all sorts of things hastily put up with signs that we would knock over. If I hit one more piece of plexiglass, I'm going to be called Scarface, because it's just that everything was put up for sighted people. Everything was put up for standing people. So people in wheelchairs couldn't see certain things. Then you add in the total collapse of our volunteer system. Most of us who have been pushed to the edges already had a high degree of reliance on family, friends, and volunteers. And because of social distancing, that collapsed. So there was no place to catch us. Transit shut down. In some areas, like in rural areas where I am, we don't have transit. We rely 100% on volunteer drivers and any friends who could drive you. So it put us all at risk. Just the day-to-day things, like if you needed to go get lab work, it was in Vancouver, for instance, someone had to go clear across the other part of town, a blind person with their guide dog, on bus systems that were very coming at different times and not times that were helpful. So it took all day to get over there and back. And while he was over there, he was nearly hit by a car, so came back because it was just too much. So as things shut down, the difficulties we generally have were even compounded by the lack of supports that are already existing, collapsed. And I think that was the main issue for us to start with.
Hey, Heather.
To start with.
And I know you and I have had a number of conversations about service dogs and guide dogs and the impact that COVID-19 is having on our animals. I myself have a service animal, and I have not taken him into public in over 3 months because I'm very nervous. I've only personally been a couple times out for very necessary things. And I feel like he's going to be needing retraining, and people who have guide dogs, all the things you're referencing, those circles and the social distancing, are things that guide dogs haven't been trained on. Do you have any other thoughts on kind of the impact on our service animals?
Sure. Our dogs are very, very, for the most part, are very social. I mean, dogs generally are pack animals, so they're used to families, which is why they make service dogs for many of them. Our dogs are the types of breeds that really respond to that. And they also respond to having routines. And their job with us is their work. So the task that they provide, and for guide dogs, the guiding they provide for us, is something they expect to do every day, like we expect to get up and do the things we normally do. And so how it affected us affected them. And so they weren't able to do the work that they were trained to do and love to do for us. And so many not being able to get out is a big issue. Also, a lot of people let their dogs out without leashes and just sent them out to go to the bathroom and roam around and come back. There's been a number of reports of dog attacks because of that. Just people's understanding that our dogs are working when they're with us. They're not a pet. And so people coming close to us, interfering with that training is a problem usually. But now there was this sense of, oh, well, maybe they're carrying the virus, and this fear level that people had. So we tended to not go out as much. Many people couldn't go out as much just because of the situation of where they live. Going up and down elevators, having to interact with other people, again, not having any mask or protectiveness. People had to stay home. So the dogs are not used to that. It interfered with their goals, their own personal goals of doing tasks for us.
Yeah, and I think in consideration, there's been a lot of conversation online about the extra costs for the disability community. And I think that one of the costs that I'm already thinking ahead to is the retraining aspect of my animal when things start to open up. So thank you, Heather. I'm going to move on to Eileen now. Welcome, Eileen. So did you want to share what some of your concerns as someone living with a compromised immune system during COVID-19 are?
Yes, definitely. So there are many people out there who live with a compromised immune system. So when COVID-19 alarm went off, a lot of us kind of sort of freaked out. One of those main concerns is living with rheumatoid arthritis. One of the number one causes of death is respiratory disease or illness. So being even young, only 34, and I don't look ill, it's still very terrifying to me when a respiratory illness is going around, because that could potentially wipe not just the elderly out, but people like me. And so one of my major concerns was, how am I going to function out in public, and how are people going to be respecting my needs as somebody with a compromised immune system, whether or not they don't have to worry about the things that I do.
Thank you. And I know that online we've had conversations about this. I started COVID-19 off with pneumonia that may or may not have been related to COVID-19, but it was terrifying to go into a pandemic and being very ill. You and I both don't look like we're not well. And so how do you find people are, when you go into public, about accommodating you, about social distancing and understanding your need to keep your space safe?
Well, a perfect example of that was, I tried to do this allotted hour that they designate for the seniors and people with compromised immune systems. I went to Walmart at early 1 hour in the morning, and I'm there right as they're opening, and I had about 5 or 6 security guards and employees huddle around me going, "Why are you here? This time is for people who are ill or are just, elderly or disabled." And I'm like, I am. And I had to teach them, like, you're going to get a ton of people in here with illnesses you've never heard of and are also invisible. And it doesn't matter which age they are. So it's been kind of difficult because a lot of people don't really understand that somebody like me can still have the same concerns as somebody who's elderly.
Yeah, I think the invisibility is part of it, and not looking like we're sick all the time. Thank you. So I'm just gonna, Miles, you've disappeared. Okay. Oh, there you are. Hi, I'm just gonna move to Miles now. So Miles, as you heard, does a lot of policy work around programs for students with disabilities. So do you want to talk about what kind of programs and responses are available to students with disabilities right now?
Well, the Ministry of Advanced Education and also the Federal Canada Student Loans Program have a suite of programs to support students with disabilities. There's financial aid programs that provide funding for books and fees and tuition. There's also equipment and services funding to help students who require assistive technology or assistive services while they're in their post-secondary education. And there's also, we have disability services that help support the student at the institution level. We have a communication access services for deaf, hard of hearing, and deaf-blind students. We have alternative text formatting for students who require alternative resource material. So there's a suite of programs that are out there to help students. The COVID issue has arisen recently, and what that has done is, with the social distancing involved and the lack of mobility for students, a lot of the courses now are being delivered completely online. Students may not have the access to disability support staff at the institution level, and they may not have access to medical staff to help them verify their disability for eligibility purposes. So we're working on a suite of policy changes to try to address those problems.
Thank you. And so how has your role changed during the COVID-19 crisis in responding to this situation such as what you've mentioned?
Well, primarily it's been coming up with workarounds, working with the institutions, working with the disability support staff, uh, working with some of our contracted service providers to try to come up with strategies that help the students access programming under these unusual set of circumstances. We operate within existing policy frameworks, both provincially and federally, and my role has been to try to find ways of working within the policy framework, or finding flexibility in the framework to let students access programs and get the supports that they need in a barrier-free way, a way of that they can get these things without having to jump through a lot of the bureaucratic hoops that are often in place.
That's great. Interestingly enough, I work at Kwantlen University as policy a coordinator. And one of the things we've done is we've been hearing from professors who are also having to learn about accessibility and supports, when in the past they didn't, because they're all teaching online. And I think that's another area that's going to be coming up of how, not necessarily from your office, but maybe like, how do we support professors in order to teach in an accessible manner from their homes for however long universities remain on lockdown?
Yeah, this COVID crisis is really starting to push the envelope for things like universal design for learning. The issue of presenting criteria and curriculum in a way that's accessible to all students it's sort of an emerging area that has been getting some support in some areas and not so much in others. But now with the movement to total online service delivery, it's really challenged the existing paradigms and really placed a lot of emphasis on technology, and that's been traditionally a way that students with disabilities have been able to access their post-secondary education is through assistive technology. So it's, as I say, it's kind of pushing the envelope, and apart from a lot of the sort of the negative things with regard to people's access, maybe there's going to be some positives out of this, because down the road, like you say, faculty and other institution support staff will be more they'll be more familiar and comfortable using technology.
Mm-hmm. That's great. I'm always trying to think of some of the positives in this really challenging time. And the one I've seen is the proof now that so many people with disabilities, we've argued over the years, we can work from home, we can do the things we need to do with the technology, and now everybody is doing it and they're learning this is totally possible. So I'm always hopeful. Thank you, Miles. So Heather, why do you think these issues are impacting people with disabilities disproportionately with regard to access, and how COVID-19 responses are coming about?
Well, I think the system is set up. I mean, our role in society is to work, pay taxes, keep the government going, spread those services out to, spread those taxes out to provinces and federally to support people in education, health, and a number of areas. But historically, society wasn't built with people, all people in mind. And certainly across disability, we were not supposed to really be in public. You know, there was almost a shame about, or something defective about the family system if they had a child who had a disability, and there was a lot of pity and, you know, money given to charities, look after us, all of that. And so we're coming out of that, but coming out of that still comes a lot of prejudice and not maybe conscious bias, but certainly a bias. And so when people design systems about how to look after people, they tend to think in that, well, what's wrong with the person? The medical model, identify what is wrong, and then find a way to look after the person. No one thinks of us as just people. And people who have, as anybody, we're all able-bodied. I want people to quit using that term to separate us somehow from the regular folks. 1/4 of Canada has stated they have a disability. That tells me that 1/4 of Canada, we found our disability, and the rest of you are looking for yours. And so as you're looking for yours, start thinking about, if you had one of ours, how would you still fit in or not fit in to society, and what barriers would be put in place? Well, the immediate barriers is, how do we support, rather than look after, but indeed support people more in the social model, that I am okay who I am. It's when I leave my door, it's my environment and the attitudes of the people and systems around me that disable me. So that, if that is what is disabling me, then we need to look at those systems. And so when we have not done that work yet, or enough of it, when the pandemic hit, immediately went to the regulars, the normals. You know, let's make sure everybody who was working had, you know, and was losing their jobs had adequate or some adequate support to at least get by. Very important. CURB was very important. But then all the money to the food banks, and then money to corporations, and then money to this and to that, and all of them were important. I say that. But no one started to think about all the people pushed to the margins, like people with disabilities who didn't fit in the system already, but were even more disenfranchised from the system of support. And all these months in, we still are. And so I think that's why it hit us more disproportionately than most people. It also hit seniors with disabilities incredibly hard. And so we have a system that now we can see very, very clearly what this system we currently have has done. It has ensured that the people who didn't count before weren't even seen. I mean, all of us all of a sudden became invisible. And all of us had a situation where there was just stupid things like not having a credit card to get home groceries delivered, not having an internet or a cell phone to be able to get information and know where to go, and what to do and who to call out for, because again, our systems collapsed. People, deaf people, were unable to get interpreters. So when they were going to grocery stores, they had to, there was another barrier put there, communication. Why is ASL not taught in the schools? You know, those kinds of things, so that we are more together than we are excluded from each other. And I think that's why it hit us disproportionately. And it's still, let's not forget, it's still hitting us and will for years to come, because the systems are still not set up to include us as part of being part of the support, being supported. And it cost us a lot of money. You can imagine the amount of money we've had to not pay our rent, not pay our hydros because we had to pay other people to do things for us.
Mhm. Yeah, I've been hearing that a lot. I've also been hearing that for people who do have support workers coming into their home, or personal care caregivers that come into their home, they've had to also now be paying somebody to do cleaning, so that because they're being exposed to outside individuals, and that's another increased cost. I just also want to note one of the things I recently reviewed, the WorkSafe BC response to COVID-19 from a disability perspective. And I really recognized how little people with disabilities were thought of in any of the plans for reopening, and making sure, you know, we're okay if we're employees, or we're okay if we're clients or customers. There was just really little mention at all. There is a little bit about mental health, but it's not even about people who live long term with a mental health disability of some kind, but more people who are newly struggling with mental health. No consideration to the things you mentioned earlier, of plexiglass going up all over the place. So people who are blind or low vision are not going to know there's these brand new barriers all over in the world that they go, or those signs on the floor where people are supposed to stand. So I really want to recognize that the lack of awareness of our experience is really obvious in so many of the policy responses. And I'm hoping that, you know, some of the pushback we've been doing and conversations like this will be alerting the various parts of government and society of.
Classes like this.
Oh, somebody's not on mute.
And you're so with it.
Somebody's, I think, can we mute them?
Also, to follow up with that,
Thanks.
Jules, I just want to say too that many people had home support and caregivers coming in. They had to self-isolate.
Mhm.
So what happened was those supports were no longer available, or when they were available, again, a lot of us are immune compromised in one area or another. Certainly for people with mobility issues, lung issues is a big issue. But people are touching us, are close to us, not wearing masks. We don't have access to the masks. We can't get them. Even if we got to a drugstore, they don't have them. So we were really set up to be the highest risk group. And you certainly saw that, how fast it went through any institutions like for elders. But for us in our own homes, we became almost sitting ducks, because the people that we had to interact with were not necessarily taking or having access to the precautions they needed to.
Mm-hmm. Yeah, we've definitely been hearing that. So I just want to move on to Eileen again. So Eileen, what ways have COVID-19 impacted areas of your life, such as parenting and socializing?
Well, parenting has definitely become more of a challenge, considering my son, he's only 7, he's in grade 2, and I've now had to tackle on the added work of being a homeschool teacher. And because I am immunocompromised, I did not feel comfortable having my son return to school. And I have this looming fear over me now when September hits for that second, the second wave. And I feel really lost on what I should be doing, what I need to be doing. And it's really challenging when you need to keep yourself safe as well as a small child. And so, and because also as an immunocompromised parent, I have different concerns than, say, a parent without a compromised immune system. So luckily some teachers have been really kind with understanding, like I have different needs. As for a social aspect, it's been very lonely because not everybody really does understand my concerns. They don't have the same ones. And a lot of the times I'm being told that, oh, you don't have anything to worry about, you're fine. But they're not the ones who really know my illness or how a pandemic really works. And I was scared of pneumonia or the flu season before COVID-19 hit already. A few weeks before COVID-19 hit, I remember asking my son's teacher, can I pick him up outside? Because every time I come into the school, I end up sick. So it's been kind of a challenge to tell people, like, even though we may have a vaccine coming for COVID-19 one day, I'm still afraid of all those other germs that are going to come up.
For sure, for sure. And I think you really touched on something too that a lot of people with disabilities are talking about, especially those of us who are single. And you know, that the isolation has been really detrimental to many people in our community, and not really seeing how, you know, an end to it for those of us who live with compromised immune system or who require support worker to go out in public, you know, to help us with our daily activities if we are out. You know, concerns about the people that we do connect to, that they are social distancing and doing all the things that will keep us safe. Did you have any other, you know, thoughts on responses and ideas around that?
Well, the other week I had to go into Vancouver for getting my monthly infusion of a biologic that helps keep my disease kind of at bay. I couldn't really get that infusion for a while because some doctors at my clinic were exposed to COVID-19. So I actually went 3 months without my regular medication thanks to the pandemic. And I've tried different things, like, should I take a cab? Should I take an Uber? Should I take the SkyTrain? And I'm terrified of all of them because I can never predict if that person has cleansed the place properly enough for me, or if they're going to wear a mask, or are they going to respect my social distancing needs?
For sure,
So
for sure.
it's been frustrating, and it's also been a lot more expensive having to take an Uber to avoid the general public to places that I need to go.
Yeah, all those additional expenses. And I think that really a fulsome response to the situation is really looking at the increased costs to people with disabilities. Thank you, Eileen. So I'm going to go to Miles. So can you talk a little bit about how the ministry, and I know you did a little bit, but do you want to talk a little bit more about how the Ministry of Advanced Education helps institutions support students with disabilities?
Well, we have a fairly comprehensive consultative framework with the institutions. I sit on a federal national committee that works with the Canada Student Loans Program. I also administer a committee here in BC amongst the public post-secondary institutions and their disability services support staff. And what we found is that over the last 10 years, the number of students with disability, the number of students identifying as having a disability at post-secondary and looking for supports has increased dramatically. I chalk that up to better identification and implementation of supports in the K-12 system. So a lot of the students that historically never would have made it out of elementary school and high school are now graduating, and their expectations are to go to post-secondary. And so the numbers have increased dramatically, and there's they're expecting a lot of these students are expecting the same kind of supports and accommodations in post-secondary that they received in the K-12 system. So we get a lot of information from people on the ground, the support staff at the institution level, and they come forward to us with lots of requests and anecdotal information about students and their unique needs. And so it's our job to work with them to create programs that help provide these services and a lot of times the resources that the institutions need to help to support these students. So things like, just recently we've had institutions come to us and say that they're getting more and more students who are looking for mobility and orientation supports when they get to a big campus. They need, or they're asking for assistance in training to be able to work independently at the institution and find their way around and find their classes and facilities there. So that previously wasn't a service that was eligible for funding. And so we've worked with CSLP, and now this year we're going to get that service added to the list of eligible services for the federal program and the provincial program as well. So it's kind of an iterative process as we work with our partners at the federal funding level and the federal agency level, and also with our partners in the post-secondary level. We hopefully will be able to build a policy framework and a suite of programs that'll be supportive of all students with disabilities and assist them to get education. One of the things I think that the recent survey work by the federal agency has shown is that post-secondary education is a real mitigating factor for poverty for persons with disabilities. So we're just, from our aspect of the larger envelope of ways that government can support persons with disabilities, we're really trying hard to make sure that what's there is effective and works for people. Sorry, Jules, I can't hear you. I can't hear.
I think you're not.
Yeah, I went on mute because Da Vinci was drinking water and it was very loud. Yeah, when you talk about the quick response that has had to happen with the changing population of students with disabilities, I've observed that myself. Attending university, I had had about a 9-year break in between my last degree and this degree, so I've seen a big difference, and I think that the ability to respond is something that your particular part of government, I think, has done well and found solutions. I know that the plan was to have a break at about 1:45, and I think it's a good spot right now. I know it's almost that. It would be probably a good time to take a break. Nicole, how long was the break supposed to be?
We were thinking of doing about 10 minutes, and okay. I invite folks, during the break or after to share any questions they might have in the chat as well.
Great. So everyone, if you want to turn off your videos and make sure you're on mute so we don't have any unfortunate incidents, we'll all just have a little break.
How do you use the chat box?
Hi. To use a chat box, you should be able to see it usually it's on your bottom menu. It'll say chat, and you can click it. And you can just write in there. Although if you are more comfortable just speaking your question or signing your question, we can also invite you to share your video.
All the meeting minutes from today to me?
Yes, we will be sending the recording and a transcript of the whole meeting at the end in a follow-up.
Because I would like to share with the SALN group.
Sorry?
I would like to share it with the Self-Advocate and Leadership Network.
Oh, absolutely. Yes, we would be. So we'll send the recording, and you can definitely share it in your networks.
Thank you.
Yes, and if the chat is not available for folks, please feel free to just let us know. We'll make a call at the time of the Q&A for anyone who wants to speak in video instead. But we'll be back in 10 minutes, and take care.
So I just want to let everybody know we got about another minute to get back. Heather, you've shared your screen with us. Not sure if you can hear me.
Thank you for letting me know.
Yeah, I was like, oh, it's Heather's screen.
Well, hopefully it wasn't anything weird.
No, it was just saying that you're trying to connect back to Zoom.
By the way, the provincial government Minister Simpson's office, several of their staff have now sent me emails, private emails, saying they are watching. They've been involved and they're quite impressed.
Good. We'll have to chat offline.
Yeah.
Okay, everyone. Just looking for Miles and Eileen and Heather to join us. Videos on. Make it so. Welcome back, everyone. So we just have about one more round of question conversation with the panelists, and then I'm going to be opening up to the many questions coming in. So first of all, so now I really want to delve a little bit more into policy responses and, you know, whether it's something that you see could be a good policy response or something that has happened that you think should continue. I'm actually going to start with Eileen. You and I were talking offline earlier, I think this morning, it all blurs together after a while, about some of the things that have happened that, you know, that have changed that are actually really positive and have been helpful to you. Do you want to just talk about that?
Yeah, I think there's a few that have actually meant quite a bit to me as somebody living with a chronic illness and as I guess somebody like being on disability, is the whole no clawback thing has been marvelous. It has relieved so much stress from myself and helped me budget so much better. It's kind of really discouraging when our disability can be clawed back if we make any extra, especially because I like to participate so much in research. And sometimes I can't because maybe I'm making too much money that month. And then another thing that I've really, really enjoyed as somebody who lives with chronic fatigue is the telehealth services that are being offered now. Not having to go from point A to point B with some services that I don't need to be seen in person has been amazing for me, being able to juggle my condition with fatigue, juggle life as a single mother, trying everything else that I take on, and has also helped keep me away from other people's germs. And I'm only able to do so much in one day with my condition, so it's helped me be able to do actually a little bit more throughout the day.
Mm-hmm. I will concur. When I was sick with pneumonia way back at the beginning of March, it was amazing to me to be able to do all that on telehealth. I mean, unfortunately, I didn't get chest x-rays, but I've had pneumonia enough that I do know what the symptoms are, and being able to get the care that I needed and have my meds delivered. I mean, it was just incredibly comforting to know I wasn't being exposed to something new. So that's
Mhm.
really great. And the clawback, I mean, unfortunately, it's different. Every province and territory is having different rules, and it's quite
Yeah.
confusing. And so, you know, in the general bigger policy response across Canada, it's not been equal, and that I know has been frustrating, just in the fact that to find information. But you know, in some ways, I think BC has done some good things. So,
Mhm.
and I think you also mentioned there was an increase in some of your funding.
Yeah, so child benefit increased, and then the persons with disability increased, which was great. I felt like I was actually able to afford some more things that I'm going to end up putting towards my health in the first place,
Mm-hmm.
that I normally can't afford, because disability pay, and I'm on two kinds, is peanuts compared to what the actual rising costs are to live near the care that I need.
Yeah, yeah. And I mean, it would be, you know, hopefully government will hear what a difference that's made to the lives of people who are on the fixed income sources, so that perhaps moving forward, those won't disappear. Thank you.
Oh, I hope so. That's my dream.
Would that be amazing? So Heather, so what are some of the missing pieces in policy and service delivery that you think need to be addressed?
Okay. The first thing is I come from a thinking, and certainly the most people come from this thinking that I know, is that we carry our rights where we go. So if we are in BC, Alberta, Manitoba, Saskatchewan, it doesn't matter. Our rights are still the same under the Constitution. So what I see is a really important beginning is that rather than having us spend so much time just trying to survive, maybe by having a, a rate that doesn't require us to be scrambling when there's more months left at the end of the money, but to actually invest in people with disabilities to have a living amount of money, to have a base to then start to develop other strategies in their life. Because right now, sorry,
Can
it's
somebody go
my,
on mute? I can hear.
um, what happens is that we're struggling with poverty so much that we can't even get the basics. So I'm really glad there'll probably be more post-secondary education over the internet. But if you can't afford the internet, if you can't afford the computer, if you can't get the ongoing training, we need to start at a place that people get the low and high tech things they need to be able to just physically be mobile, and also get the rate of our income to a place that's livable. And we can thrive from that. But if that is not there at all, then you're battling too many fronts all at once. And that, I think, is policy, needs to be a huge policy shift.
Great.
I just want to say one thing, that I was offered psychological services for all us people in the disability who are working very hard as volunteers. We do all the time, but doubly so with COVID, to support each other and to find ways to get food to people, and just this whole underground amount of people. And they said, oh, well, if people aren't emotionally feeling well, then maybe, you know, we can get you a psychologist and therapist. And I said, you know, what do you pay them an hour now? 100, 150 bucks an hour? How about I need 3 sessions a week and just give me the cash? You know, like, I don't need someone to tell me how to budget. I don't need to express to a therapist what I'm going through, because they can't solve the problem. I need an off-ramp from poverty. I need an on-ramp to being able to thrive. And I need it to be seamless so that I can carry my rights right through my life, right through anywhere I live in the country. So I think that's an important way to look at it. Quit trying to treat the outcome of oppression with a therapist. That's
Yeah.
not always helpful.
Yeah, I think you're really right. And I think a lot of people with disabilities across the country noted that how much money the government thought was a livable amount at the beginning of this. And you know, it's brought a lot of conversations from our community to talk to policymakers in government and legislators about why do they pick the amounts that are so below the poverty, you know, line for people with disabilities, and the lack of medical and all the other things that impact us and make it impossible to move forward. So thank you. Miles, I wondered, I've gotten through your questions. I'm just wondering if there's anything else that you just wanted to add to talk about for students with disabilities and response during COVID-19.
Oh yeah, just that because we're, you know, we operate in bureaucracy, and we you know, operate in a kind of a structured process whereby individuals access our you know, our programs and supports. You know, there's things like signatures and documentation, and that are part of that, or part of those procedures. And what we've tried to do with this COVID, you know, problem, and what hopefully this will, you know, what this will support moving forward, is just maybe, you know, taking a different approach. You know, we're looking at, you know, taking, if people are trying to, verify the fact they have a permanent disability, and you know, existing, you know, criteria asks for specific kind of medical documentation. Well, perhaps something else can be, you know, can be used in its place, because, you know, individuals might not have access to a medical assessor right now. Perhaps you know, they've got something else that they can provide that helps to support their, you know, supports their verification of disability. If they, you know, perhaps these people have a history of receiving supports, especially with regard to, you know, the educational environment. Perhaps they don't have a current psychoed assessment that verifies their learning disability, but they've got an education plan all the way to grade 12 that shows that they were receiving accommodation and services to help them be successful. So perhaps, you know, we can incorporate that into the policy. And, you know, maybe a signature from a medical assessor isn't required. Perhaps, you know, we can look at letterhead or something, some other identifying feature that gives us, you know, a level of comfort that it's legitimate documentation. So that kind of thinking, getting away from the medical model of disability and more towards a social model, and you know, how do we best support persons with disabilities with, you know, the minimum amount of, you know, red tape and bureaucracy. So that's the kind of thing that I hope to see, you know, happening in the future.
Yeah, for sure. I'm seeing a lot of that even happening in the university space. I'm in Cloverdale, and you know, I have my committee is all over the province, in their locations, and there's always this scramble for all of us to print papers, sign things, scan them, send them to the next person, and suddenly now it's magically possible for us all to do a electronic signature that you verify by clicking on something, and you say, I'm verifying it's me, and it's all done. And I was like, why couldn't we have been doing this for the last 5 years? You know, so thank you. And you know, those sorts of solutions I think are going to long term hopefully help so many in our community. So we're wrapping up right now our session of the panelists talking, and there are a bunch of questions being shared. I'm just going to I just want to confirm with Nicole, is this the order that I should work through them?
Oh, feel free to work through in whichever order you feel best. I've just been putting them in the order we've been receiving them in the chat box.
Okay. And I also want to let folks know, if you're more comfortable raising your hand and alerting that you have a question. I know Nicole is watching for that as well, or someone behind the scenes, because there's a lot of screens going on. So there's a really good question here, and it's directed at you, Miles, probably because you work at the government and maybe you've heard something. But the question is, prior to COVID-19, there were plans to unveil new provincial accessibility legislation. While I understand there are mixed reviews of the benefits of such legislation, does anyone, particularly Miles, have an update on where that's at?
That's kind of over in the social development and poverty reduction ministry. And I've had some peripheral experience with that or exposure to it. My understanding is that they're looking very closely at the federal accessibility legislation, and with the idea of perhaps using that as a template for the provincial model. But other than that, it's not something I've really been on top of. I'm sure there may be somebody here who's probably either in that ministry or else somebody who's a little more tuned into the. Looks like Heather's a little more tuned into the process than I am.
I can see that. I've met with Minister Simpson and staff a few times, but I haven't heard anything since COVID-19 started. Heather, have you?
Yes, I've been working with their staff and with the minister's office on some areas, and he's had several conference calls with people throughout the disability community. And 4 weeks ago, he said that it is behind now. It will, and remember, this is an accessible framework legislation. It is not legislation for policy and for programs. It is a framework that then from that policy decision-making standards and regulations will be developed. What it does is outline the way that they're going to do it. So he said it's probably looking in January. They don't think they'll have it ready for fall session as they had hoped. So, and also next spring is election. So there's a lot of tremendous pressure on them. They're trying to do their best, but they also have to use other parts of the government, legal and others, that are now full tilt boogie on the COVID response. So that's where it's sitting.
Thank you. I just want to note that I have the questions have been moved into a document for me, so I don't have always the name of the person who asked the question. I'm just going to move on to the next question, which is for Heather, potentially. Along with the provincial disability legislation, the provincial government introduced changes to the provincial guide and service dog legislation prior to COVID. Heather, do you have any update on the status of the provincial guide and service dog legislation and what the revised timeline is for passing the changes?
Okay, the changes are very minimal that they are doing. They have agreed to three major things. They now said this legislation cannot override human rights legislation, which we knew, but now it's stated. The second thing they've done is anyone who gets a dog from two particular, that are accredited through two particular organizations, the International Guide Dog Federation and the Assisted Dogs International, no longer have to register to get rights or their rights supported through this legislation. And the third area was a minor change for dog trainers, that they didn't have to have one piece of ID for each dog. But what has happened is now that the Commission of the Office of the Human Rights Commissioner has now opened, we are looking seriously at the legislation, if it should even continue. Partly because it is not necessarily in keeping with human rights. There are some excellent protections in it, but those can be made in other ways to ensure we don't lose ground. But where the legislation sits, it's in the House sitting. It was brought in with a number of other changes to other acts, and it will be voted on at some point, but COVID hit right as that was put on the floor of the House. And the BC Coalition is continuing its work with both the Human Rights Commission and the Solicitor General's Office, who wrote it. You should note, though, a number of ministries that we met with, like Ministry of Transportation, have changed how they're going to be incorporating this, and they're not going to be allowing profiling or carding anymore on BC ferries and a number of other areas. So that has been a great success in changing the mindset from registration and expecting cards. That is being changed dramatically.
Woohoo! That's great. So I have a question here for Eileen from Francis. Thank you, Nicole, for putting names in. What is the best way to access telehealth?
I would find, well, telehealth would be just on your phone talking to your provider, or then there is virtual health, which I would normally do through Zoom. That seems to be the platform that everybody's using now, like us now.
Great. Does that answer your question, Francis? Can't see your response. Is the question which company or whose company? I think
Zoom?
Zoom.
Mm-hmm.
Yeah, I think you can just search for telehealth, right? You can Google it, or you can talk to your physician.
Yeah, when it is an option, the provider will send me an email and say, here is the telehealth link to for your appointment this time, and you just put in your Google Calendar and you show up kind of like you are now with a screen, and you can talk one-on-one. I did a few with a physiotherapist, which was kind of neat, but then I did telehealth service with my social worker where I didn't have to look face to face, which was actually kind of nice because it was emotional.
Right. Sorry, I'm just looking at questions. From Nadine, hello all, I'm the constituency advocate from MP Paul Manley's office in Nanaimo Ladysmith. From the beginning of the pandemic, we have been hearing from many disenfranchised people, especially seniors and people with diverse abilities. When the DTC $600 payment was announced, I could see right away there were going to be people who wouldn't qualify. It's more convenient to go through CRA via the tax system, but it's clearly not the best way. And if it goes to people who receive CPPD, how would it also go to people on provincial disability? And what are your thoughts around that? So Nadine, I've done a lot of conversations with media, and my thoughts on this have been formulating over the last week very much. I mean, I believe there must be a way that governments, the provincial, territory, and federal government have been speaking and, together in ways that I've never seen them do in my entire lifetime. And I feel like there are solutions, much like what Miles said of self-identifying and those, like I don't get the disability tax credit. I wouldn't qualify for that. I'm very impacted by COVID-19, during this pandemic. But there must be a way to identify people who are on disability in the provinces, other ways that people can, when you file your taxes at the end of the year, you might have to produce some documentation for having received any benefit that you did with your disability. And I'm still looking for solutions, but I agree that using the disability tax credit as the measurement is not useful. And it brings me back to, many years of work that the Council of Canadians with Disabilities has done looking at reforms to the disability tax credit. And maybe it's time that actually gets the reforms that have been recommended by the disability community. Do any of my other panelists have any thoughts on a better way to? No? Okay. This is something I've been hearing very much from Sheila. My sister needs caregivers for safety reasons and for personal care. However, during the pandemic, we could not allow caregivers into her home because they had multiple contacts. Will there be any possibility of a solution for this problem? As I know many folks with disabilities who are housebound and unable to receive proper care in addition to my sister. So Sheila, I've been hearing this a lot, and some people have found workarounds. I belong to a COVID-19 and mothers and people who do research on mothering Facebook page. And we've been talking a lot about the amount of care that's been falling, on the shoulders of mothers to fill in the gaps, whether it's caring for elders because, the same reason people are not coming into their home, caring for, your extended family with disabilities, trying to figure that out. We've heard people have been injured. People, are ending up with bed sores and things like that because they're not getting all the care they need. So I'm not sure what the solution is. I just know that it's a huge problem. And I'm looking for ideas because it's, whenever I have an opportunity or any of, the WASC Center has an opportunity to put forward ideas. I think it's really important that, we identify where's a gap or a challenge, and then we identify what are some solutions. Did any of the other panelists have thoughts on that one? No.
Here's part of the problem with finding solutions. It isn't just one, it's multifaceted. Everything touches each other. So when we talk about making a more just society, it isn't just for one class or one group or one section of society, it's for all of us. And so those are bigger questions. And also when you have been in that discriminatory place your whole life, or a large part of your life, or all of a sudden in your life, we don't have a lot of skill sets to know exactly what to do. So what it has to do is we need to be talking with each other and working towards change. And to do that, it has to be fairly people at the table that get impacted by the change must be able to speak to that. And so a lot of times those voices aren't heard. And there's many good solutions. People have all sorts of solutions, but it means re-changing the system of how we view people and how we include people in society. Is that a priority for society? And so those are the things everybody's going to have to be asking to ensure that we all have a more equal place in how we are treated and how we are heard.
Thank you, Heather. Okay, there. Somebody was attempting to share a screen. So I just want to check in with Nicole. Are there any hands up? Because I can't see that.
Hi, yes, I think we had a hand up from Warren Walker. If he wants to share via video, perhaps this would be a good time.
Okay.
Can you hear me okay?
Yes, we can.
Let me share from right here.
Hi, yes, we see you.
Great, great. I have two issues here. I'm disabled too, I'm a senior. I'm hemiplegic, which means one side my left side is paralyzed. I go on SkyTrain. I've been arguing back and forth with SkyTrain for some time. I'd love to see SkyTrain or TransLink make a policy that when they go to SkyTrain station, you either have to be wearing a mask. You must be wearing a mask of your own, or SkyTrain gives you one. And secondly, they use hand sanitizers before they go. I'm in a situation where I have to use a wheelchair to get in the SkyTrain when I can walk. I love to walk during nice days, not in the rainstorms. Nice days I like to walk. I can't walk because if I put my hand on the pole, I'm taking a risk. I cannot put a glove on with one hand. I've used my left with my teeth. That's it. I tear the glove with my teeth. So I'm screwed. I have to use my wheelchair every time I use SkyTrain. That's my first issue. Second issue is obviously the $300. And I think people don't think people really understand how important that $300 is for, especially for disabled and seniors. I supported my wife. We're getting through because I'm really careful with money. But reality is there are a lot that aren't. They're not doing well with what's going on right now. It needs to be addressed.
Thank you. Yeah, I think that your points are really important, and it's something I'm having a lot of conversations about safety going out in public, that everybody should be wearing a mask. It's not just about, the other person. It's about those of us who live with a compromised immune system, or maybe, we have to be in close space. I know they're encouraging, but they're not saying they have to. I know that TransLink's giving out a bunch of free masks. And I don't know, and I don't know what the cleaning that's going on in TransLink, what it's looking like for folks who use TransLink. I have airborne anaphylactic allergies, so I don't use public transit ever.
Why aren't we telling TransLink to get their collected heads out of the sand, get their heads out of the sand, actually get real about this and do it at the grocery stores instead of screwing around with this? I'm really upset about it. Really upset about it.
Mm-hmm, mm-hmm. I mean, I
Can
think
somebody talk to TransLink to make that happen? I've sent emails and phone calls to Blue trying to get this thing done.
well,
I can put you in touch with their accessibility committee if that is at all helpful.
I'm on the accessibility. I'm co-chair of the accessibility committee.
And they're still not listening.
They're not listening at all. That's an important point. I know them personally, John, Adrienne, David. I know them personally. They're still not responding. No, everybody's going away when it comes like they have a selective hearing around this. Please, somebody raise hell with them because I'm tired of it. Tired of fighting.
mm-hmm. I mean, I guess that's an opportunity for this project that's looking at where the gaps are, is to really amplify where people are falling through the cracks and that things are not being addressed. So thank you, Warren.
Also, part of the BC&DP Disability Caucus, I'm hosting a small subgroup to follow through with what's happening with upcoming disability legislation. Heather, can you give us your contact info so we can do that? Follow up with you and find out what's going on with that legislation.
Sure.
Awesome, thank you.
Great. All right. So I have a question. I'm just looking at time. Yeah, we have a few more minutes. I have a question from Richard for Miles. Since students with disabilities are doing more learning from home, are educational institutions finding a range of accessible platforms to offer their courses through?
Yes, that's one of the real pressure points right now for institutions, is to try to develop the technology and to get their faculty and their curriculum in a into a platform. I think Zoom is one of the most popular, but I understand there's a couple of other ones. Microsoft Team and Skype is another one I think that's being implemented. I'm not a tech person myself, but one of the things we've done with in terms of administering the equipment programs for students with disabilities is we've facilitated the dissemination of equipment. If a student who's on the program is now having to study online and they need additional technology, we're making that technology available. And we also have a loan bank as well. If you don't qualify for the federal funding, you can still get access to needed technology for your courses. So I can't speak specifically for institutions, but one of the things that we've discussed is how they're kind of scrambling now to make everything, especially for the upcoming semester in September, how they're scrambling to make sure that everything is going to be online, because my understanding is come the beginning of the program year in September, that's the expectation, is that a majority of curriculum is all going to be delivered online.
Mm-hmm. Yeah, and I mean, Miles, if the information about the that access to equipment and such is shareable at all, I think that would be something that could be shared out for students to know what's available.
May I quickly say something?
Sure. I'm trying to figure out who's speaking.
Michaela.
Oh, Michaela. Okay, thank you.
So I was on a the Microsoft team meeting today, and it is not a good system to work with, because it kept on timing out on us, me and my friend. So I wouldn't use Microsoft again, just so you know.
Well, thank you, Michaela. It's not something that I have a lot of experience with. My understanding is actually government is going to Microsoft Teams, so I'll definitely take that into consideration, because I'll probably be using it internally. Hopefully it's a system that can be set up to work with outside users as well. It's probably okay working within an agency where we have a lot of IT support, but when people out there in the field, individuals out there in their homes, they need something that works for them.
Mm-hmm. Yeah, and I mean, I've used, I think, every system. I've probably used 5 or 6 different ones, and they all have pros and cons. Currently, my favorite is Zoom, though, for accessibility. Thank you for that, Michaela. So I have a question from Nicole. Hi, Nicole. I guess you're going to find me somewhere, hey? Nicole is a reporter from Kwantlen Polytechnic University, and she is wondering, how is KPU, Kwantlen Polytechnic University, adapting to online learning when it comes to students with disabilities? So I know that some of the faculty have been working with the accessibility center to adapt things and figure out better learning outcomes. I do know that many students have been struggling, and I know that John O'Brien, who is our student advocate at the Kwantlen Student Association, has been supporting many students who've been struggling to figure out accommodations from home. And I know that for some people, they don't own their own system at home, or they, the programs that they would use at the university. And I do know also that there are some struggles with doing exams and accommodating exams for some students. And again, it's been hit and miss. And I think it's just a matter of making sure that the conversation is continuing between the students, the Accessibility Center, and the university response. So thank you for that question. How are we doing for time, Nicole? Do we have time for one more?
Yeah, I mean, we're happy to go a little bit over and let you decide when to close, Jules.
Sure, I'm always mindful of I like interpreters and captioning and deadlines, because I've been chairing a very big organization.
Maybe one more question and then we'll close.
Okay.
And I'll the question list out to everyone as well in case folks want to connect in different ways.
Sure. So I have a question from Ada. How can, and this is for all the panelists, I think, how can municipalities engage people with disabilities to create more inclusive and accessible spaces during this time of physical distancing, especially for creating more accessible public spaces, streets, sidewalks, plazas, etc., and transportation networks? So Eileen, we haven't really heard from you in the question period. Do you have any thoughts on this one?
Yeah, that one I think I'm a big fan of campaigns, just to remind others that the masks, they're not necessarily to keep yourself safe, they're to keep somebody else safe. So some more campaigns would be great. And just going back to what the guy was saying about being on transit, I was on transit yesterday, and at one point there was about 7 people on the train, and I was the only person wearing a mask. Mm-hmm. And so that terrified me. And so, yeah, I think people there needs to be more awareness campaigns that, yes, we might be in the second wave, but there's still people with first wave concerns.
Mm-hmm. Mm-hmm. And just on sidewalks and such, one thing that I've been seeing a lot of is this idea of shutting down sidewalks and creating outdoor restaurants on every sidewalk. And I think it's really important to always keep in mind people with mobility disabilities, people walking with their guide dogs, parents walking with their children, that there's actual space, that you're not blocking curb cuts, that you're not creating something that makes space more inaccessible for people with disabilities on the sidewalks. And I've also seen a lot of things where people shut down streets and parking. And again, people with disabilities, with mobility disabilities, often rely on parking close to spaces so that they can get the things they need to get done during a day. And shutting things off, and making people walk 6 or 8 blocks becomes a brand new barrier for somebody who used to be able to go and do things independently. Mm-hmm. Those are 2 thoughts I had. Did you have anything to add, Heather?
Yeah, there's a street in, for instance, bringing up this point, there's a street in Victoria they've just closed so that they can have more outdoor cafes using sidewalks. But it's also the street where a hotel is. And so there would be nowhere for me, say, to get to that hotel, taking myself, my cane, and my suitcases to get to that hotel. So they've really set up barriers for accessibility for everyone. And then you add people who may not have that kind of ability to walk that far. It's just, again, everybody's trying to find a solution, but maybe not an inclusive solution. Mm-hmm. And that's, I think, the thinking of the day.
Thank you. And Miles, did you have anything to add?
With regard to municipalities, it's just as as a personal, as a wheelchair user, I think that now is no different than any other COVID or otherwise. You really notice things like accessible curbs and sidewalks and ramps and that type of thing. So, yeah, I mean, as somebody who's sort of traveled around the country a little bit, you notice that when you get into older areas, older communities, the accessibility drops off significantly. So just for municipalities when they do their rezoning and rebuilding, that all accessibility is taken into account, not just what they have to do through the building code.
Yeah, thank you. So I want to thank everybody for attending today and participating in all your amazing questions. There are so many. This is such for me, it's a topic I'm very passionate about, and I know for my panelists, and I can see from your questions and the high numbers of people that registered that obviously this is really important to our community, that we keep the conversation going and we find solutions to policy. So I'm going to pass it over to Nicole to wrap things up.
Thank you, thank you, Jules, first of all, for moderating this discussion, and all our panelists for all their incredible insights. And I've learned so much from being here. And thanks everyone for tuning in. We will be sending out a follow-up email with a recording, a transcript, relevant links as necessary, and as well as the questions and maybe opportunities to connect offline. So thank you again, and we wish you all the best.
Thanks, everyone. It's great to see your faces.